I'm Dr. Jane Bridges. I'm the diabetes doctor here at Good Samaritan Hospital. It's my pleasure to present to you a diabetes educational program that I hope will allow you to build a good foundation with which to take care of yourself. Good Sam is committed to providing diabetes education to all patients with diabetes and their families. So I hope you find this presentation to be beneficial. So let's begin. And it's called Helping You to Manage Your Diabetes. So what's diabetes? Diabetes is a disease of hyperglycemia or high blood sugars, usually blood sugars higher than 130. Now, if you don't have diabetes, typically your blood sugars will be between 70 to 120. The higher the blood sugar, the more symptoms you may have, and you may experience things like excessive thirst, increased urination, especially through the night, increased hunger, but yet maybe losing weight, fatigue and being tired. A lot of elders think, well, I'm just getting old, when in fact it's diabetes out of control. They may experience blurred vision. They may present with infections and wounds that are not healing. Other infections like yeast infections, bladder infections, and skin infections can lead us to think about whether there may be diabetes. And we may see some weight loss. Some basic facts about diabetes. 1 in every 10 people in the United States has diabetes. That's about 34.2 million. But 1 out of 4 of those people are unaware that they have diabetes. So diabetes is, so to speak, a silent killer until it's finally diagnosed. In people over the age of 65, 25% have diabetes. So this is a disease of aging. It's the 7th leading cause of death in our country. 1.5 million Americans are diagnosed each year, and costs annually are around $245 billion, at least back in 2019 and probably now higher. This goes for direct and indirect costs, and the indirect costs are related to disability and being unable to work and provide for your family. Medical costs for people with diabetes are more than twice as high as for those who don't have diabetes. So this is a very expensive disease process. So the better you take care of yourself, the lower your healthcare costs. Now, diabetes can be managed with comprehensive diabetes education. That's what we're here to provide for you today. Proper meal planning, exercise, medications. Medications really do work, but you have to take them. So there's a big issue with adherence to medications. So when patients don't take their medicines and their insulins, they may not be well controlled. More importantly, we want you to participate in your own health care. This is your disease. It doesn't belong to anyone else. It belongs to you. So do your best, step up to the plate, and manage your own diabetes. It's important that you do have support from family and your healthcare team. And of course, family, friends, and coworkers are very helpful in supporting you through your disease management process. So here's our philosophy. Actually, this is my philosophy that I'm going to share with you. I know many of you will not be my patients, but this is the philosophy that I extol upon my patients. We aren't looking for perfection, but we are looking for your participation. Our focus is to prevent, and follow these words for me, premature death and disability. That's what my job is all about, is to keep you feeling well, keep you alive, and help you live long with diabetes. We want to prevent the premature disabilities that occur with this disease. Our goal is that diabetes will not control you, but you will control and manage your own diabetes. We are here to support you, and we know that you have the harder job. You have to live with this disease day in and day out. Note that our decisions are based on what you bring to the table when you come see your healthcare provider. If you come with nothing, no blood glucose meter, no blood glucose data, you don't even know how much medicine or what you're taking, you're not going to get very good decisions from us in return. So bring everything that you can to the table and come and get your money's worth when you visit your healthcare provider. And remember, you're not paying us to guess. So the more information we can see, the better decisions we can make on your behalf. Okay, now let's talk about the types of diabetes. Type 1, which is also known as insulin-dependent juvenile diabetes, is a disease that occurs in about 5% of all people with diabetes. We don't really say insulin-dependent and juvenile diabetes anymore. We just call it type 1. These patients make little or no insulin production. They have a very low C-peptide level. C-peptide is a blood test that we can order that can tell us how much insulin the patient is making, and that helps us make the correct diagnosis. This is an autoimmune disease in which the body, via antibodies, destroys the insulin-producing beta cells within the pancreas. These patients must take insulin to survive. Failure to take insulin can lead to diabetic ketoacidosis, which is life-threatening and potentially fatal. There may or may not be a family history of diabetes. This is a disease that can just pop up, but it does have a genetic association. These patients make antibodies, and anti-GAD, IA2, insulin antibodies, and zinc T8 are 4 of the antibodies that we sometimes order to help us, again, make the diagnosis of type 1. Now, type 2. Diabetes is a disease in which the body is resistant to insulin at fat tissue, muscle, and liver tissues. The pancreas becomes overworked trying to produce enough insulin to overcome the insulin resistance at these tissues. And unfortunately, the pancreas will start to decline in its ability to make adequate amounts of insulin, and this consequently leads to high blood sugars or hyperglycemia. The liver overproduces glucose, and the gut empties too quickly, which can all lead to hyperglycemia as well. And then the kidneys reabsorb glucose from the urine, and that leads to higher sugars. Notice how I've underlined these tissues. These are organ systems in which our current medicines work at that level. Now, 95% of people with diabetes have type 2 diabetes, so this is the most common diabetes. To manage this disease, again, lifestyle changes are so important, and we'll talk more about that here in a bit. We use oral pills, injectables, and insulin to control patients' blood sugars. There is a strong family history associated with type 2 diabetes, so we'll see multiple generations. And by the way, I don't believe it skips generations. It occurs in all generations. Now, for people with type 2 diabetes, it is frequently associated with those over the age of 40. They are usually overweight. There may be a previous history of gestational diabetes. Patients of ethnicity have a higher incidence of developing diabetes. And then there are other signs of insulin resistance like polycystic ovarian disease, hypertension, and elevated cholesterol. Some other types of diabetes, gestational diabetes. That's diabetes that's diagnosed during pregnancy, usually in the 3rd trimester. Mature onset diabetes of the young, also known as MODY, occurs in patients under the age of 30. This is a diabetes that behaves like type 2 diabetes. There is a high genetic predisposition for this disease, and it's autosomal dominant. But many of these people can be managed with oral agents instead of insulin. Late onset autoimmune diabetes in adults, also known as LADA. This is a type 1-like diabetes presentation. They do have antibodies, but their blood sugars are less labile because these patients are diagnosed later on in life. So the pancreas is still producing a bit of insulin that keeps them much more stable and easier to manage. And then there's diabetes related to cystic fibrosis. So what are the symptoms of diabetes? Excessive thirst, excessive urination, and excessive hunger, and that includes bedwetting. Some children who may be dry through the night may start to wet the bed, and that could be a clue to the development of diabetes. We call these polys, as in polydipsia, polyuria, and polyphagia. So if you hear doctors say polys, that's what we're referring to. We may see weight loss or weight gain. Patients are frequently very fatigued, tired, and exhausted. They're unable to do exercise or to even do their job. They will experience blurred vision. They may have infections, as I noted earlier. The GI tract is involved in poorly controlled or early diabetes. Patients may complain of constipation, heartburn, nausea, and vomiting. Slow healing wounds that can get infected are noted. The nervous system is affected as well, with numbness, burning, tingling, sharp shooting electrical pains in the feet, legs, and hands. And that's all because these nerves are being bathed in high blood sugars and they're being injured from the toxicity of glucose. Patients have emotional issues when their diabetes is poorly controlled. They can be very irritable, short-fused, angry, and depressed. In fact, they might be treated for depression when in fact we need to get the blood sugars under better control to help them feel physically better so they can be emotionally well. There's sexual dysfunction in males and females. So this concludes the first session. So I'll meet you back in the second session.